Good morning, students. Today we are going to see the second chapter of your syllabus, the work of nursing and healthcare. Okay, so this chapter is mainly about nursing and what they do in healthcare. The social interaction in health industry. Social interaction means the interaction between professions is mainly between the physician and the patient. Okay, but in modern times, that is these days, medical treatment is not just about physician and the patient. There are a lot of other health professionals who are available, who are working for the benefit of the patient. So these people who work are working in the treatment, procedure in laboratory, therapy, rehabilitation and administration. So all these people are in different occupations in the health industry, and this includes nursing, and all these professions other than the doctors is called as paramedical profession, and they all work usually under the physician's authority and control. But now most of these professions are growing independently and have their own rules and regulations and independent profession, and nursing is one of these independent professions. Okay, so we'll first go to the first subtopic, nursing history and development. So here we will see the history of nursing and how it developed over the several years or even hundreds of years. Okay, the word nursing literally actually means a mother taking care of the child. Before nursing became a profession, the word nursing was talking about how a mother took care of the child, especially a young child who was not able to take care of himself. Okay, so nursing has its origin in the mother's care for helpless infants. It is not a child who is 15 years old or 20 years old or 10 years old, but a helpless infant, a very small child. So that child is not able to take care of himself, and only the mother is able to take care of that kind of a child. So the word nursing is derived from the Latin word nutriere, which means to nourish. Okay, nourish means giving food. So that is how the word nursing came into being. So the history of nursing can be divided into different eras. Like just your history subject you study about different eras or different kingdoms. The nursing development and history can be divided into different eras. The first is the age of Christianity, and then the Middle Ages, then the 15th to 19th century, the Florence Nightingale era, the Civil War era, the 20th century and the 21st century. So first, during the early years when Christianity first came into this world, that is around 2000 years back. So that was the time when women started entering into nursing. Okay, that time nursing was not like the present day nursing as a profession. Those days, the religion of Christianity taught that men and women are equal before God. Most of the other religions did not provide equality to women, whereas Christianity told men and women are equal. And the religion also told that people who are sick and suffering need to be taken care. So this is how many nuns who did not marry but they lived their life to take care of poor and sick people. So this was the early stages of nursing. And those days, before the 19th century, from 2000 years back up to 100 years back, what happened was hospitals or places where patients were living were mainly for the poor and lower socio-economic people. Those who were rich were taken care of by doctors and nurses in their own houses, but those who went to the hospital were mostly the poor people. So nursing was considered to be a charity, mainly taking care of poor and the sick people, very sick and very poor people. So that was how nursing started 2000 years back. Then in the Middle Ages, that is from 1100 to 1200 AD, there were many charitable institutions that started taking care of the aged people, sick and the poor people. So nurses delivered this kind of care under the direction of the physician or priests, and this was the time when midwifery became very famous. That is, women who are going to give birth, they were cared by nurse midwives, and this was during the Middle Ages. Then during the 15th to 19th century, there were many wars. One of the wars in Europe was called as a crusade. And during that time, because of the war, a lot of people became injured, and there were also sick people due to diseases. So these crusades established a lot of hospitals and nursing groups. So some of the nursing groups like Sisters of Charity were founded during this time or started during this time. They cared for the sick people in hospitals and asylums and poor houses. And some nurses who were famous were Mother Elizabeth Seton, who started, whose name, who was part of the Sister of Charity, and it became Daughters of Charity later on. Okay, so during these days, nursing was not a formal course. There was no proper education, but mainly it was knowledge and skill that was transferred from one experienced nurse to another person, and that is how these people became nurses. They learned how to take care of the sick and the dying people. All this was happening till 18th century. Then during Florence Nightingale's life, this is a very important phase of development for nursing profession, and for your course also you may get questions about Florence Nightingale. Florence Nightingale lived between 12th May 1820 to 13th August 1910. She is the founder of modern nursing, and she was also called as the Lady with the Lamp. So you should know who was the Lady with the Lamp? Florence Nightingale. Who was the founder of modern nursing? She is Florence Nightingale. Okay, so she was a British nurse, and she was also a statistician and social reformer. So that means she was doing a lot of work. And during the war, Crimean War, there was a war called Crimea. British and the Allied soldiers were fighting, and during that time, a lot of people became injured and they were dying. So during that time, Florence Nightingale spent a lot of hours during her night, during the day, taking care of these injured people. And especially during night, when she went to the wards, she would carry a lamp and she would walk from patient to patient. And that is why all the people who were cared for by Florence Nightingale, they started calling her the Lady with the Lamp. Okay, so what else did she do other than taking care of the injured people? During this time, she established the first nursing philosophy based on health maintenance and restoration, and she made this in the Notes of Nursing. So health maintenance means how you take care of a sick person so that their life is maintained and how they are restored. So this she did in her own notes. And in 1853, Florence Nightingale went to study in Paris with the Sisters of Charity, and she was appointed as the superintendent of English General Hospital. Okay, she also brought about a lot of changes in the hygiene and sanitation and nursing practice. This helped the number of people who died to reduce drastically. That is, the mortality rate during the Crimean War went down drastically, and that is why she is called as the Lady with the Lamp, and she is also called the founder of modern nursing. So next, during the 20th and 21st century, the movement of nursing, what Florence Nightingale started using her notes, and how she improved nursing practice using hygiene and sanitation, it became a scientific research based body of nursing knowledge. Okay, so nursing became scientific and also research based, and this knowledge of is a body of knowledge and practice became important as nursing profession. Okay, so there was a lot of research going on, there was a lot of knowledge gained about treatment of various kinds of patients, and this is how the profession of nursing developed from early ages to the 20th century and the 21st century. So we'll go to the next topic, which is development of the profession. So first we'll see what is a profession. Okay, profession, and then we'll see how nursing profession developed. Okay, nurses have authority to control their own work. Any job, for example, if you see a building being constructed, Okay, do the people who carry the sand and the bricks, they have control over their work? No, they do not have control over their work. There is somebody over them who is telling how many bricks to carry, how much of sand to bring. So like that, those are not professional jobs because they are under the authority and control of somebody else. Whereas nurses have the authority to control their own work. They can decide what kind of work they do. So there is an exclusive body of specialized knowledge. Okay, specialized knowledge means each disease, each patient who is sick, a nurse knows how to take care of that person. And for them to gain this knowledge, they undergo a long duration of formal training. So we will see each training and how long they do in a little bit of time. So when they undergo this training, they are able to work with patients with a lot of ability. Ability is also called as competence. Okay, so they are also able to control their performance, work performance. Then they do service to the society. They are able to regulate their own profession, and they have a system of credentials. Means if you achieve some education, if you achieve professional excellence, if you do certain kind of work, attend workshops, then you are given credentials that you are experienced in those areas of work. And there is also legal reinforcement of professional standards. The government actually provides them authority to conduct these courses. So in India, the Indian Nursing Council is the legal authority which maintains the standard of nursing profession in India. The other areas of development of nursing profession is the ethical practice. There is a college structure, there are rewards and public acceptance. And these areas make this profession to develop over the years, and it is developing even now. Okay, so let's go to how the nursing profession and the students' education in India works. Okay, the first course which was started many years back was the auxiliary nurse midwife. Okay, this was not even a diploma course, it was less than a diploma course. It is the auxiliary nurse and a midwife. Midwife are women or nurses who are able to deliver a pregnant woman. So the auxiliary nurse midwife was the first course. Then the diploma general nursing midwife program was started. Okay, this was a diploma course. Then slowly as time went by, the higher education courses were started. University level programs with the basic BSc nursing, post basic certificate BSc nursing were started. Then MSc nursing, MPhil and PhD programs were also started. So nursing is now a profession where the education is available at diploma level, bachelor's level, master's level and doctorate level. And at global level there are several educations available: the associate degree education, diploma education, baccalaureate education, accredited licensure certification, master's degree preparation, doctoral preparation, continuing and in-service education, licensed practical nurse education. So these are some of the courses available at the international level or the global level. So because of this wide knowledge that the nurse gains by studying these kinds of courses, it is a highly professional course, and the nurses who come out studying these courses are professionals. Okay, this is how the nursing profession has developed over the past several years. Now we'll see why nursing. The next topic in your syllabus is nursing as a particular type of work. What is a particular type of work? Particular type of work means what kind of work a nurse does and how they are called as professionals. Okay, how nursing is a profession and what are the different types of work that a professional nurse takes or does. Okay, so nursing is the art. Nursing as an art is the application of knowledge and skill to bring about desired result. Okay, so nurses use their knowledge and skill to bring desired result, and what is the result which they seek? They want to restore the patient's health to normalcy. Okay, so they use their skills and knowledge to restore the health of a sick patient. So it is an individual action. Each nurse does their own work, and it is carried on by a one-to-one relationship with the patients, and it is based on the patient's immediate needs. So based on the patient's level of sickness, the nurse will take care. A patient in the ICU will be given a lot more care. A person in the OPD will be given as much care that the person deserves based on the sickness that he is undergoing. So let's see what the definition of a profession is. Profession is a type of occupation that meets certain criteria that raise it to a level above that of an occupation. That is, a profession is a calling that requires special knowledge, skill, and preparation. There are several occupations. Occupation means a job. These jobs do not need special knowledge, skill, or preparation. For example, which I gave you already, a person who is carrying sand and bricks in a construction site, they don't need special knowledge or skill. Anybody can carry the bricks and sand if they have the strength to do it. But nobody can do a nurse's work unless they have the skill, unless they have the knowledge that is required to do the work. And that is why nursing is a profession, and it is above a occupation. An occupation that requires advanced knowledge and skills and special services is called as a profession. And nursing has the need for such advanced knowledge and skills because they take care of so many different varieties of patients in the neuro ward, in the ICU, in the cardiac ward, in the OPDs. So there are different kinds of patients that they meet, and the nurse needs high level of knowledge and skill to ensure that these sick people become normal again. Okay, so I have taken 7 criteria for nursing profession. We'll go one by one. What are these 7 criteria for the nursing profession? High level of individual responsibility and accountability. Each nurse should be responsible and accountable for their actions when they take care of the patient, when they provide service and care for the patient. Okay, so accountability is by law, because nursing is a profession and it is governed by the Indian Nursing Council. It is legally, the nurse is accountable. That means if a nurse does not carry out her work properly or her duty properly, then the law can punish her, because as a nurse she has certain responsibilities and she has to do those responsibilities. So every nurse has individual responsibility and accountability that is legally ensured for the patient's benefit. Okay, patients can also be called clients. So the welfare of the client or the benefit of the client is the responsibility of the nurse. Then the body of knowledge. What is body of knowledge? Body of knowledge is nothing but what are the various knowledge things that the nurse needs to know. How can knowledge be acquired? Knowledge can be acquired by reading books, by undergoing a course, and it is also acquired by doing research. Okay, so nursing profession does a lot of research, and through this research the body of knowledge increases, and every nurse has to have this body of knowledge. So they have to study, they have to understand, and then they have to practice nursing profession. Then the third criteria for nursing profession is altruism. Altruism in English means for the benefit of everybody or the benefit of the society. So nursing is a service profession. They do a lot of service for the sick and the needy. So the members of the profession are motivated by the fact that they will be able to help the sick and the needy people, and ultimately it is for the good of the society. One example, during this coronavirus, you see that the health workers are being praised by, right from the Prime Minister to all the people, they are praising the health workers, especially the doctors and the nurses, because they are the ones who are doing a lot of work in spite of the risk to their own lives, their own health, and their own families' safety. They are doing a lot of service towards the society. This is called altruism, which is good of the society. Then the next reason why nursing is a profession is the code of ethics. What is ethics? Ethics is nothing but the boundaries within which the profession works, and it is a responsibility and a guide for the people in the profession, what they should do and what they should not do, their social responsibility. So, like most other professions, doctors have their own code of ethics, all health workers have their own code of ethics, and nursing profession also has its own code of ethics. So every single nurse who is part of this profession has to follow this code of ethics and behave professionally, and that is one of the important aspects of this profession. Then the next important aspect of nursing profession is the autonomy. What is autonomy? Autonomy means freedom to decide. Okay, so professional autonomy in nursing means they themselves regulate their profession. Nurses govern their own profession, and nurses are self-directed. So the Indian Nursing Council is set up by the government of India and is a professional body. So they make rules on how the nurses should be, how the nurses should work, how the nurses should study, how the nurses should progress in their profession, and how they should be punished in case they do not follow the rules and regulations. So this is called professional autonomy. So the nurses are able to self-regulate, self-govern, and self-direct. So the nursing council sets standards for all its members. Every nurse who finishes the nursing course has to become a member of the Indian Nursing Council. Then only the nurse can practice as a nurse. And once they become members of the Indian Nursing Council, they are regulated by the rules and regulations of the Indian Nursing Council, and they have to follow the rules and regulations. So this is what autonomy means. So they are independent in the work, and even though they are independent, they are responsible and accountable for each of their actions. Whatever they do, they have to be accountable for it. They cannot do things in their own way which risks the life of the patient. Okay, so they should make sure that they do for the benefit of the patient as per the law. The next is professional organization. The nursing profession has its own organization. Okay, so all the nurses are under the Indian Nursing Council, which is the professional organization. The Indian Nursing Council is set up by the government of India, and any advance in the nursing profession, advance means going forward, the person is developing or improving in the nursing profession, is through the high standards set by the Indian Nursing Council for nursing practice. Okay, so the high standards are set by Indian Nursing Council for every nurse, and they have to follow that. And most of the professionalism started with Florence Nightingale, and based on her improvement of the profession, the later years each government in the world set up its own rules and regulations for the nursing profession. Finally, we also should talk about evidence-based practice in the nursing profession. What is evidence-based practice? Practice means doing the work. What does a nurse do? She works with the patient and developing or improving the health of the patient and also the community, restoring the health of the person. So all this should be done in the right way. How do you know whether it is the right way or the wrong way? That is learned by research. So whenever you do research and come out with new ideas, that is called evidence, and whatever work you do based on the research is called evidence based practice. So nursing is a profession that is based on evidence, and all the interventions or treatments that are given to patients who are suffering from different kinds of diseases is based on the research that is done by nurses. So nursing is a profession that works on evidence based practice. So there is a systematic method of evaluating and finding out what is best for the patients. And once the nurses find out what is best for the patient under a particular disease, then they follow that based on the research guidelines. So this is called evidence based practice. And nursing is also a profession that assumes responsibility for the continuous care of the sick. Okay, they cannot abandon the sick after some time. They take care of the injured people, the disabled people, and the dying people. So a nurse is a person who takes care of every kind of sick people, who is mildly sick to the extremely sick, and the people who are terminally ill and dying. Nursing is responsible for encouraging the health of individuals, families, and communities in various settings. They not only take care of the sick people and the dying people, but also ensure the health of normal people, of individuals, families, and communities who are normal. They also should be healthy, they should not become sick. So that is also the responsibility of the nurse. And other than this, the nurse is actively involved in research, management, policy deliberations, and patient advocacy. What is policy deliberation? The government makes various policies on healthcare. So the nurses are involved in creation of these policies. What is patient advocacy? It is for the benefit of the patient and their recovery. So all these areas nurses are working. So this is the nursing as a particular type of work or a profession. So in short, nurses are highly professional people who have a high level of individual responsibility and accountability. They are professionals who have a body of knowledge. They are involved in altruistic activity, that is benefit of the good of society. They are also involved in, they are having a code of ethics, and they can practice independently. They have professional autonomy, and most of the nurses are under professional organization, which is the Indian Nursing Council, and they follow evidence based practice, that is based on research. They do all their activities of caring for the sick people. Other than this, nurses who care for the sick people also care for the health of individuals and communities who are not sick, and they help in improving the normal health of these people. So we always think nursing means they take care of the sick and the injured people and the dying people, but nursing is also involved in improvement of health of normal people. So preventive health, taking care of other areas is also part of the nursing profession. Thank you.